to the 2013 GMOM. Thank you very much for volunteering. We appreciate it. If you have any problems on the clinic floor with anything at all, I will list down the leads for you. Myself, I'm Tom Jager. I am the co-chair along with Dave Lee of the clinic floor. We have leads in each department. Our restorative lead is Henry Benson. Oral surgery leads are Dick Singer and Ken Hutchinson. Endodontic leads are Evis Babbo and Max Ferguson. Prosthodontic lead Brooke Corbett and Donnie Brown. And CAD-CAM lead are Michael Chaliff and Carol Wolf. So any problems you need, get a hold of one of those guys. While on the clinic floor, if you need to take a break, contact your lead. Let them know. If it's a short break, that's fine. We want you to get up and stretch. If it's going to be a long break, we may steal your chair and put somebody else in there while you're gone, so we can treat more patients. Our number one priority for this year's GMOM is going to be safety. All patients will be escorted at all times by patient ambassadors. You might know them as runners, but we're calling them patient ambassadors. Absolutely, positively no two-handed recapping of needles. Figure out a way to scoop up the needle with one hand. We want no needle sticks this year. When you're done with a patient, remove all your sharps and heavily soiled gauzes. There's containers nearby labeled for sharps and soiled biohazards. Don't walk around on the clinic floor with a tray full of sharp instruments. Get those out of the way first. That's another way to stay safe. If you do have a needle stick, please report it to one of your leads. We have a protocol to follow if there's a needle stick. I want to make sure everybody's safe. On the clinic floor, when you get to the floor, familiarize yourself with the layout. At the end of each row will be tea tables that'll have all kinds of disposable supplies that you can use on your patients. There'll be curing lights in the restorative area. There'll be amalgamators, things like that scattered around. Also on the end of the tea tables will be computer stations that will be patient records areas that you'll escort your patients to when you're finished. In the central area, central supply and central sterilization. You'll find all your other supply needs over there. Central sterilization will have places to get new instruments, and it'll have drop-off for personal instruments. If you label them with your name and your station number, you should get them back in about 45 minutes. And there will be a separate place to drop off your GMOM instruments, which are just generic instruments that you used from the clinic itself. Our treatment goal is to relieve pain. We're trying to do as much as we can in as little time as possible. So keep that in mind. We try to limit it to about 45 minutes per patient. So do what you can. This year's GMOM, we hope to have the triage organized a lot better than our first GMOM. Most patients, all patients will arrive on the clinic floor with x-rays, and the triage will have those x-rays this time, which they did not have last time. So the triage should be a lot better. I realized last GMOM, a lot of people came down on the floor and they had already gotten numb in a certain area of their mouth, and then you looked in there and found a big hole in another area of their mouth. As always, you have your loops on, you have better lighting, you have magnification. Use your own clinical judgment, but keep in mind, try to rely on the triage and do what you can to, they followed protocol and decided what was best for that patient at that time. So if you can follow the triage lead, that would be best. But if you have to stray from that, use your own judgment. We have cards on the floor that are signals. Hold these up so your leads can see the cards. A green card means you need a new patient. A red card means you're done and you want your patient taken away. A yellow card means you need a translator. Orange card, hold up if you're having equipment problems. Purple card, there are going to be some Nomad portable x-ray machines. If you need to take an x-ray, hold up a purple card. We'll see if we can get a Nomad for you. And of course the white card with the red cross means you've got a medical problem. Hold that up, or yell if you need to. Keep in mind that if you hold it up like that, the back side will have another card, so hold it up like that. So you've got the same color on both sides. So when finished with the patient, we would like the doctor to escort the patient down to the tea table. That gives you a chance to get up and stretch your legs, and your assistant will go about readying the chair and the equipment for the next patient. There'll be somebody at the table to enter the data in the computer. It is your responsibility to make sure that this happens. A few things like that fell through the cracks last year where treatment performed was not entered on the computer. Also, it is your responsibility. This is the doctor's responsibility. Use blue ink only and enter the data into the chart. So write in blue ink. Refer to the have your assistant refer to the yellow chairside card that has instructions on how to wipe down the equipment, purge the suction line, etc., etc. There's also going to be hand sanitizers at each station. There's two choices here, but with this one, I was told works for 8 hours and kills bacteria. Is that true? 6 hours. Okay, 6 hours. Anyway, use this in between patients. Obviously, you're going to be wearing gloves, but there's not sinks around the clinic, so try to keep things as clean as we can. When you take your instruments up to central supply or central sterilization, I mentioned this earlier, there's going to be GMOM instrument drop-off and personal instrument drop-off. You'll get your instruments back in about 45 minutes. In closing, I would like to say that these patients are our guests. Please treat them with guests, as our guests. On the clinic floor, be flexible. Things are going to happen. Things are going to change, just as in your office. You start one procedure and you end up going into a totally different procedure. Just be ready for that. It'll be very noisy. There'll be some mayhem out there, but it's a very, very organized mayhem. And I believe you'll really enjoy your time on the clinic floor. Do wear comfortable shoes. And thank you very much again for volunteering.